Good morning, esteemed panelists, and good morning, viewers, to this session on the National MedLegal Awareness Campaign on Organ Donation. I am Ravindra Mangal, the Executive Director of the Institute of Medicine and Law. And on behalf of my institute, I welcome you all for this discussion. We all know that we have a major problem on hand as far as some of the patients requiring transplants are concerned. We have thousands of patients awaiting transplant, whether it is a kidney transplant, a lung transplant, a liver transplant, or a heart transplant. We have the problem, and ideally on paper, we also have the solution, which is organ donation. But unfortunately, the numbers are not matching up. There are various problems because of which organ donation is not happening in the way that it should or it could be happening. There are procedural aspects, there are legal aspects, and then most important is the aspect of lack of awareness. And so we have taken this responsibility of trying to create awareness amongst the masses on organ donation. We believe that trying to counsel the patient when he is admitted in hospital or the relatives of the patient regarding organ donation would not be the ideal time. The ideal time is when somebody is not in hospital. Maybe we can start these sessions, the awareness campaigns in schools and colleges, so that if and when required, people can come forward to donate their organs or the organs of their relatives. With this small note, I welcome Dr. Bhagwat Karad, Member of Parliament, Rajya of the Gujarat State High Commission. Dr. Karad, can you please open the session for us?
First of all, I congratulate Mr. Ravindra Mangal. He is consistently trying for this organ donation and how it will become easy. He is all the time trying. He is calling all the different panelists, discussing and making different notes for making it easy. So I, on behalf of all panelists and one of the doctor, I'm congratulating Mr. Ravindra Mangal. I know there are different specialists, different doctors and different field specialists in this discussion. So although I am a doctor, I am not practicing nowadays, but I know the problems in the medical field. And as I am in the medical field and now I am in the politics, I am member of the Rajya Sabha. I also congratulate all the panelists who have joined this discussion. And I declare that session is open for the discussion, and whatever the conclusion comes, already I have told Mr. Ravindra that I want a short note so that I will be able to ask and I will be able to deliver the lecture in the parliament. And not only that, if possible, if required, we will make a law which will make easy organ transplantation, organ donation. As he said, there are some difficulties in procedure and legal aspect, and it needs awareness. Of course, this awareness will be done from the different media and different communications. But for the legal aspect, I'm definitely help and going to give their different views from Mr. Ravindra. And so I again declare this discussion or the panelist is open for the discussion.
Thank you so very much for your kind words, Dr. Karad. And I am really thankful to you and to Justice Tripathi ji for the passion that you have shown to this cause and for your kind words. With this, I hand over to the CEO of the Institute of Medicine and Law, Mr. Sundarajan, to take forward the proceedings of the day. Over to you, Mr. Sundarajan.
Thank you so much, Mr. Ravindra Mangal. Very kind of you to introduce the Chief Mentor and Justice Ravi Tripathi ji. Without much ado, let us begin the session now. We have very short time, so I will again request all panelists to keep to a minimum possible time, so about 3 minutes. Now, while we are discussing about the MedLegal problems on organ donation, what better way than to first start with the patients and then discuss these problems to take it forward. So I welcome you all. And first, I would like to invite Mr. Saurabh Sanjay Pandey, a patient who has already undergone transplantation, and I mean, let's hear his story.
Am I audible, sir?
Yes, you are. Please go ahead.
Good morning to all of you. My name is Saurabh Sanjay Pandey, and thank you for giving me such a great opportunity to talk in front of you, all of you. So, I was working in one of the great pharma company, that is Serum Institute of India Private Limited. In the December 2018, during medical checkup, my problem was detected that my creatinine was 7.1. Then after I took another treatment for 2 months, then in the March 2019, my creatinine was 45. So I was in a very bad critical situation. Then Mr. Sunil Javle sir helped me a lot. They treat me like in a good manner. Then we have decided to do a kidney transplantation. Then first of all, my mother was my kidney donor. So, but due to some unfortunate result of lymphocyte kidney cross-match, donor was replaced with my wife. So my wife was the donor for me. So in the December 2019, my kidney transplantation was successfully done in Pune hospital, which is at in Pune. So it's been a 1 year. I'm very well in a good situation, but I would like to mention some points that legal documentation procedure was quite hard for uneducated persons. As I am an engineer, so I have all the knowledge of that legal documentation procedure, but uneducated people can't understand, don't understand the legal documentation. And another lots of time we have to spend for testing of donor and recipients. And one more other thing is that actually, sir, after post transplantation, no medical insurance or medical facility is not available for after the post transplant.
Okay, is that all? Yeah, thank you so much. You've kept a minimum time. You've stuck to your points as you had promised. Thank you so much, Saurabh.
Thank you, sir.
Let me now go to another patient number 2, who has requested their identity to be kept anonymous. Please go ahead, but they would like to share their problems and their ordeal.
नमस्कार, मी एक डोनर आहे. मी माझ्या मुलाला किडनी दिली आहे. आता आमचं 2018 मध्ये माझ्या मुलाला त्रास झाला डिसेंबरमध्ये, आणि तिथून आम्ही आमच्या फॅमिली डॉक्टरांनी आम्हाला सजेस्ट केलं की तुम्ही हे सगळ्या टेस्ट करून घ्या, आणि त्यातून असं आम्हाला कळालं की त्याची एक किडनी फेल आहे. तर तिथून मग आमचं सगळं स्ट्रगल चालू झालं. पण आम्ही आता ऑपरेशन करून आमच्या ऑपरेशनला आता 1.5 वर्ष झालंय, आणि आता आम्ही दोघंही एकदम फिट आहोत. पण मला ह्या 2-3 गोष्टीवर बोलायला नक्कीच आवडेल सर, की ज्याला आम्ही आमच्यासारखे आणखीन खूप लोक सामोरे जातात, की त्यामध्ये लीगल प्रोसिजर आहे, जी पोलीस व्हेरिफिकेशन आहे, आणि वकील प्रोसिजर आहे, आणि फॅमिली मीटिंग आहेत. ह्या सगळ्या गोष्टींना आम्हाला खूप सामोरं जावं लागलं. आणि त्याच्यामध्ये जे पोलीस व्हेरिफिकेशन आहे, एकदा जाऊन त्यांचं काही होत नाही, तिथे 3-3, 4-4 वेळा जावं लागतं. वकिलांचे एवढे डॉक्युमेंट्स असतात की ते आम्ही आमच्या फॅमिलीतून एज्युकेटेड, माझ्या मुली चांगल्या शिकलेल्या असल्यामुळे ते आम्हाला सोपं गेलं. पण खेडेगावातून जी लोक येतात त्यांना हे खूपच कठीण जातं सर. तुम्ही एका फॅमिलीला 4-4 वेळा तिथे यायला लावता. तर त्याच्यामुळे मग त्यांना खूपच त्रास होतो. आणि मला हे एक गोष्ट बोलायला आवडेल की अवयव दान करा. कारण ते कोणाला तरी एक नवीन जन्म देऊ शकतो. आणि त्याची काळजी करू नका. डोनर फिट असल्याशिवाय डॉक्टर पुढे जाणार नाहीत. तरी ऑपरेशन करून जी लाईफ भेटते ती आपल्याला खूप बेटर असते. कारण डायलिसिसवर राहणं हे काय असतं हे पेशंटला खूपच त्रासदायक असतं ते. तर ऑपरेशन केल्यावरती जो आनंद मिळतो पेशंटला आणि ते पाहून आपल्याला डोनरलाही खूप बरं वाटतं. ते काही वेगळंच असतं. तर माझी एवढीच रिक्वेस्ट आहे की जी लीगल प्रोसिजर आहे ती थोडी सोपी करा. ती सगळ्यांसाठी खूपच चांगली राहील. धन्यवाद.
Okay, धन्यवाद. Well, if I could, translate her main points, I think she was mentioning that definitely there's an appeal to everybody that they should donate their organs, and only if the doctor finds it fit, they even go ahead. But she did mention about the legal problems, police verification, lawyer procedure, and the family meeting, and they being called again and again for the various tests or for filling out various forms. I think that is one thing that she's mentioned. Now let me go ahead to another patient. The last one is Mr. Shubham Sharma. Now he has been waiting for an organ, so he's a recipient. Mr. Shubham Sharma. If you can please go ahead. Yeah, you'll have to unmute yourself, Shubham Sharma. You're on mute.
So right now?
Yes, you're now.
Yes,
go ahead.
Yeah. Hello everyone. I am Shubham Sharma and I would like to thank you Mr. Ravindra sir and Dr. Vishali Patil ma'am for giving me the opportunity to share my thoughts. I am a type 1 diabetes which we discovered at the age of 7 years. So taking insulin injections for more than 15 years now. Professionally, I am a qualified software cloud engineer. So till 2018, I was working in software company in September. Got to know that my both kidney failed and I would have to get on dialysis 3 times in a week. So I had to left the job. Now I'm facing so much problems like even no IT companies, no organization, and even shopkeepers also don't give a job because you are in dialysis. Everyone tell that you are in dialysis, you have to go for 3 times a week. So no one can offer a job, even shopkeepers, any organization, no IT company. So I'm facing so much problem. After so much research, I'm shifting in Pune in 2018. Since then, getting it treated under a Dr. Vishali Patil ma'am for pancreas and kidney transplant. Every day, every night, I sleep with a hope that next day my transplant. Hope so. I'm getting a goosebumps. That call is from hospital, and I might be called for a transplant. I lost my job. My dad is retired also. With my parents shifted here in Pune for Jaipur only for treatment. This all is emotionally, financially, and mentally for draining, which I cannot explain in words, sir. I would like everyone to encourage the donation of body parts, organs, so other people's help to get a new life. It's very important for the people who fail the organs, and nowadays, approx 1.6 year more than. My transplant number is 1, but till now I cannot receive any organ. And I am facing so much problem, so much looking for a better tomorrow. I like from the last 1.6 month, my transplant is on the underway, but no organization will be to help me to overcome these situations. The main problem is that during the duration of dialysis, we have to spend a lot of money in dialysis and dialyzer. We have to take more injections. We have to take many side effects. Nowadays, I feel my other organ also affected to the side effect of dialysis. In lungs, I have got an infection. My heart blood vessels will get weak. So I thought that everyone should encourage for donation of organ.
All right. Thank you so much for sharing your story. And I really hope and pray that you are able to, get an organ soon. But I understand your financial problem. I think there are some other practical difficulties also. Like you raised a point about organizations not hiring you because you have to undergo constant dialysis. I think this is another important problem. I will now, invite all the panelists on board, and I would first like to begin with
Sundarji, 1 minute. Just one.
Dr.
Before starting panelist discussion, I will need one application from Shobha on the name of the Prime Minister Relief Fund, and he will get 3 to 4 lakhs rupees from the Honorable Prime Minister's office, PMO office. So I will send my email ID, and just if he sends the application on the PMO office, then I will forward it, and I will see that he will get the money, and particularly he will need quotation from his doctor. How much expenses will be required? That certificate will be required. Naturally, then he will get 3 to 4 lakh rupees from the PM office, but needs doctor certificate, hospital certificate.
So Shubham, you're on mute.
Sure, sir, we'll do that.
But if I can tell on behalf of Shubham, sir, thank you so much. And this is really a wonderful gesture by you. If one person can get benefited because of this meeting, I think we're worth our time spent here today. Thank you so much.
Thank you, sir. Once again, for giving me opportunity. Thank you so much, sir.
Most welcome, Shubham. All the best to you.
Welcome. Thank you, sir.
Dr. Aarti Gokhale, transplant coordinator at the ZTCC, and you've heard some of the problems here from the patients. And our idea here, our mission is to speak about the MedLegal problems and see if we can ease some of these for our patients and for the doctors themselves. So over to you, Dr. Aarti.
Thank you very much for inviting me here at this juncture as a panelist. I heard all the patients what we were saying, and I suggest that at large level awareness is the most important thing to promote organ donation in our country. As compared to other Western countries, we are at very low and poor rate of organ donation. But still, I am proud to say today that we as Pune zone is doing excellent work in entire Maharashtra. As last year we have donation done of about 41 donors, and today also at this 28th of January we have done 5 donations in our zone, in Pune zone. But Pune zone is very large, comprising all Nashik, Satara, Sangli, Kolhapur and Solapur cities. But still, we need to push people more and more for organ donation. And for that, we have to do a lot of activities on war footing level, along with the NGOs, along with government agencies. And as one of the donor has spoke about life-related organ donation, that process, yes, I agree with her, process should be little more simpler to the donor families. But on the other hand, some of the process we have to follow, and we have to follow all the rules and regulations as per our Human Organ Transplant Act. There is no option for that. But you have to look at other side that yes, certainly along with the NGOs, Rotary clubs, Lions, and with the government agencies and NGOs like we are having a very good NGO working with us as Rebirth Foundation at national level also, and Mohan Foundation, there are Shatayu, there are many, Organ India, many NGOs are doing good work, but still we all need to take a good and collective efforts to more promotion of organ donation, and then only the gap between patient organ requirement and the supply will be minimized. That's all I would like to say.
Thank you very much. I think you've got a very important point on board that, of course, processes should be simplified, but there are certain required processes. NGOs can play a big role in, at least in helping meet between donors and recipients, or at least educating uneducated people.
Yes, just 1 minute. Just 1 minute. I just would like to say one sentence at the end. That now I'm working in this field for so many years and working in a big city like Pune. But here, my experience is that more than educated people, uneducated people, those who are rickshaw driver, might be the laborer, construction laborer, they are very much prone to support organ donation than our educated people. I don't know why, what is the reason, but it is the reality. And I have a proven statistics with me that.
Great point that. With that, I would now like to invite Dr. Mayuri Bhargave, transplant coordinator at D.Y. Patil Medical College and Hospital. Your points, please.
Thank you, sir, for giving me this opportunity. I would like to highlight the point which is given in the concept note, the need of streamlining organ donation and transplantation activity at center and the state level. That is the issue of the state, but while doing counseling of the patient, we always notice that if people who are coming from the various backgrounds, though they are from the educated background or they are from uneducated background, they don't have a simple idea about organ donation also. मुझे ये बताना है कि उनको बहुत सारी चीजें ऐसी रहती है कि छोटी-छोटी चीजें कि नेत्रदान के बारे में काफी सारे लोगों में अवेयरनेस है, बट पीपल आर नॉट एट ऑल अवेयर अबाउट organ donation after that. So awareness aspect is very much important at this level, because we are lacking in the awareness, and because of that demand and supply gap is there. So I would like to suggest if the government can take steps like HIV AIDS awareness program and pulse polio eradication program. In those programs, they reached up to the grassroots level of the country. Like that, if they drive the program National Organ Donation Awareness Mission on news media. There are many ads regarding some of the national illnesses, communicable diseases. So like that, they can have an advertisement regarding organ donation. Then it will definitely impact. At least people will see something, organ donation is there, and they will take interest and they will gather the information. This is what my feeling. Another point I would like to highlight is the caregivers, challenges of the caregivers and patient waiting for an organ. Like we had Shubham Sharma, who was telling us while on the dialysis, he is having multiple problems like economical issue pertaining to manage his expenses, as well as emotional issues. Parent को जो रहता है कि मेरा बच्चा बीमार है, उसको कब मिलेगा, and they are helpless because they are not able to give the organ to उनके बच्चे को वो दे नहीं सकते हैं या कहाँ से मिल नहीं रहा है. बच्चे को सामने सामने देख के उनको बहुत स्ट्रेस भी फील होता है, सोसाइटी का भी बर्डन रहता है. ये सब चीजें जो है वो हम ऑर्गन डोनेशन अवेयरनेस के जरिए कम कर सकते हैं, क्योंकि लोगों में अवेयरनेस बढ़ेगा तो ऑर्गन डोनेशन भी बढ़ेगा. एंड अनदर इशू इज दैट नॉन ऑर्गन ट्रांसप्लांट रिट्रीवल सेंटर्स, law has given permission to them for the retrieval of the organ or for the awareness of the organ. जो भी नॉन अर्बन ट्रांसप्लांटेटिव सेंटर है वहां पे बोला गया है कि आपके आईसीयू में अगर कोई ब्रेन डेड पेशेंट है तो आप उसको अंगदान का ऑप्शन दे सकते हैं, बट आई थिंक दे डोंट हैव अ ट्रेन्ड ग्रीफ काउंसलर्स and they don't have any compulsion to do that. I think so. I'm not aware, but as of now, if everybody is aware, we are getting very less donations from the non-transplant organ retrieval centers because if we are in their shoe, like empathetically thinking about them, they don't have any उनको इसके बारे में पता ही नहीं है कि हमारे ये कार्य करने से कितना महत्व मिलेगा या उनको रिकॉग्निशन कुछ तो दिया जाएगा, तो आई थिंक सो दे विल कम फॉरवर्ड एंड I would like to suggest कि retrieval centers also and non-retrieval centers also they should have an audit, yearly audit or 6 monthly audit by the government that they are declaring brain dead or not, and they are going to the relative for organ donation request or not. I think so. These are very small things, but I think these will impact more and more. I think so. This way we can increase the donor pool, and we will definitely benefit to the society through the organ transplantation. Thank you so much.
Well, thank you very much. You raised very important and pertinent points in a very short time. But I think one of the most important points that I liked is your appeal for a grassroots level drive for organ donation, the way HIV and other some of these schemes have been done by the government. I think that is a fantastic. And lack of incentive and training at the transplant center, retrieval centers, even non-retrieval centers. I think that's an important point.
Yeah, recognition. I'm saying not monetary benefit, but recognition. If
recognition, sure.
THOTA center does the organ donation, say like 20 donations happened in the any of the state from the NTORC. So those organizations should be recognized at the state level or national level, so that they will come forward. कि something is getting हमें नाम तो मिल रहा है. Yes, we are not getting patients, not getting benefits, but हमारे कार्य के लिए हमें कोई तो सराहना कर रहा है. So that is important.
Fantastic. I would now like to invite Dr. Vaishali Patil, multi-organ transplant surgeon, Dinanath Mangeshkar Hospital. Your views, please.
Good morning, sir. Thank you very much for inviting me to this platform. So I think what Shubham Sharma said and what other two patients said, what Madam Aarti Gokhale said and Mayuri has been mentioning is what I see on a day-to-day basis. And this has been my life for the past more than 20 years. What I would say, I would like to raise 2-3 important points which I feel really make a difference. One is that what Aarti Madam said is that it's not the uneducated which are really the ones who have difficulty in accepting death. It is the educated people. They are quite aware of organ donation, but when they are faced with a decision that their loved one is brain dead, they have difficulty in accepting that this brain dead is actually death. Their loved one is already dead. When they see their loved one having normal chest movements because of the ventilator pushing oxygen, their body feels warm because of circulation, because of the blood pressure medications, then they feel that their person is alive, and then the doctors are asking to pull the plug. Doctors are not asking to pull the plug. The organs will slowly wither away and stop working, but the person is dead. I think this is something which is really not there. And therefore, when you see the donor functions, felicitations, which organizations do, you see a large population, almost 90% uneducated people, where they accept death much more easily, much more straightforwardly. There is no confusion in their minds. It's the educated people who have so many doubts about everything, the medical fraternity and what goes on. I think too much information or sometimes wrong information can create havoc. So more important, awareness about the true concept of brain death equals to death is something we need to spread everywhere or need to be aware of. Second is, I think, like Shubham Sharma said, that he is financial, emotional. I think he's left his state and come back to another state because the organ transplantation multi-organ is available here. So for somebody to lose everything, he does not have a good personal life, he does not have a good financial life, no job, no career. And then when he waits for organ transplant, getting funding is an important aspect. Currently, the way funds are available is only for single organ. Shubham Sharma, like patients like him, are waiting for dual organ, where the cost is twice. So somebody waiting for a heart lung, or somebody waiting for a liver lung, or a kidney pancreas, they need more funds. So current present situation, when you apply for funds, you get funding only for one transplant. It should be funding per organ. That way it would really make a difference to these people. And I think third point, which I think is a legal documentation, which one of the patient raised, I think if we could streamline that from the legal and the clinical point of view, the authorities could make it more simpler for, I think, live donors who are keen to donate, it would really reduce the hassle. I think that is something, these are the 3 points I would like to raise. I think it's an important topic, and I'm glad that Institute of Medicine and Law is bringing this to the big platform. Thank you.
Thank you very much. You've raised some very, very pertinent and important points again, and we will take these points up as we go further. Is brain death really death? How do patients' relatives be counseled? Financial problems, especially where there is multi-organ transplant, is definitely a very big challenge for people today. I would now like to go ahead and invite Dr. Sunil, who is an MBBS, DM Nephrology at Jahangir Hospital. Sir, your views, please.
Yeah, thanks for inviting me for this this discussion. Basically, I agree with everybody that this awareness should start from the society. So it should not be when the patient is already brain dead and then counseling the patient makes very difficult for them to accept such things. And the awareness should start from when the patient is not in the hospital per se. From doctor's perspective, I have been working in, I've worked in many government hospitals. I did all my residencies from the government hospital. So basically, we did some awareness programs in government hospitals, but there is many misinformation also. Means the doctors themselves are very afraid of these legal issues. So the law should be the law. I think transplant coordinators and this ZTCC should take up this issue, because in non-transplant retrieval, where the institutes where there is transplants are not going on, these the doctors over there, the intensivists or say whoever is taking care of those patients, they don't want to get involved because they are afraid of these legal issues. So I think the awareness among the intensivists in the non-transplant retrieval centers also should be done. Transplant centers, definitely they are more aware about this cadaver donations or this, but non-transplant retrieval centers, they are very afraid of this legal issues, and they are not basically, they were told about it basically. Another thing should be the ancillary test should be looked for this apnea test, because 6 hours, many a times it becomes difficult to maintain the cadaver. And during the 6 hours, there is a chance that family may also get discouraged. To keep the family motivated for 6 hours, it usually may not be 6 hours. It takes longer than that, because counseling hoti hai, uske baad apnea test, uske baad 6 hours, and during that time maintaining the donor also might be difficult. So I think this should be taken up by everybody, and we should have some way out of it where we can the brain dead should be declared easily, and that could help in long term also. We can increase the numbers with that. I think non-transplant, just like Mayuri said, the non-transplant retrieval center should be focus of ZTCC, I think. But ZTCC Pune has definitely done a wonderful job in COVID pandemic. Also, 41 cadaver donors is wonderful. I think that should be appreciated.
Thank you so much. I think you also touched upon non-retrieval centers and awareness, especially among the patients and also the relatives of the patients even before they reach the hospital. Thank you very much. I would now like to invite Mrs. Amruta Devgaonkar, a social activist and a member of the Rotary Club.
Hi everyone, thank you for having me here. I'm a part of a Rotary organization which does a lot of social work. I am very proud to say that Rotary Club in Pune, the entire district, did a great awareness campaign in 2018 on 9th of August, and all over India campaign was run on that day, and we achieved a Guinness World Record of getting pledges, online pledges for 24,111 members who pledged that they will donate their organs if at all they are declared brain dead, just in case. So it was in all the discussions here, we see that it is all about awareness, telling people what organ donation is and increasing the awareness. I think hope is something which all the patients should have, because India is getting there like other countries. We are on the positive side of the upward curve of awareness of organ donations. Media, I think, should play a very vital role, although they are popularly praising and they talk about green corridors every now and then. But maybe they should consider a small suggestion, like just they have a horoscope part and a crossword part. Why not have a small section for organ donations that took place in the city? You know, it will help people just create awareness at a micro level. But you know, every day you read something, then it starts registering in your mind after a few years. So maybe a small column, just couple of lines, that today so many donors took place, so many donations, and so many people's lives were saved. So something like that. Another small suggestion is like for Shubham, why not CSRs should be appealed, or they should be allowed to give jobs to such patients who are having a difficulty in going to a workplace and doing the job for, you know, the complete 8 hours or 10 hours a day. So I sincerely feel, and it's my humble request, that the lawmakers here who are participating should consider that CSRs should allow people or patients to be given their share of, because this is ultimately a part of CSR, I feel. If it could be incorporated in your legal system, I don't know how it will work. Another thing we always found was that students are more receptive. So NSS is a very big organization and they get credits for social work. So why not organ donation awareness should be a part of their credits? We have like 20,000 students in Pune itself, and everyone gets 1 or 2 points for promoting an organ donation awareness campaign in their city or in their society or in their locality. If they are given points, students will definitely work for that. And I'm very grateful to Aarti, because Aarti Gokhale in Pune is doing a great job. ZTCC Pune, I have been working because of her. Our Guinness World Record was done successfully. Rushali is there. Rushali also I have been working with her on this topic. So I feel that just like we did this one Guinness World Record, although it was just a cherry on the topping, I would say, but still, it's more about awareness and it is a continuous process. So I request Mr. Bhagwat, who is an MP here, if we could do it again at a national level, consistently, we have to keep on doing this. So one record is set, but then somebody has to break that record. So that way we reach the masses. So why not again carry out a campaign at a national level? And we will be here to help out, support. We have the systems in place to create more awareness. So it's my request to Mr. Dr. Bhagwat, if we can again do it at a national level, we will be here. So, and just a last point for Shubham, since he mentioned, Rotary Club has donated many dialysis machines to many hospitals in Pune. So if Shubham, you can just take my number from Dr. Rushali Patil. We have centers where you will get a free dialysis or at a very subsidized rate. So please get my number from Dr. Rushali, and I will write you a reference note where you can get free dialysis from the hospitals where Rotary has donated the machines. So thank you once again.
First of all, congratulations on that Guinness record. But yes, more than that, I think people like you make this a really for all of us to live in. Thank you very much for all your efforts.
Thank you for having me.
I would now invite Mr. Rajesh Shetty, President of Rebirth Foundation, to present his views, please.
I would like to thank IML for inviting me. And from the last 5 years, we are working for the awareness of organ donation in the society. We have around 150 volunteers with us. And what we found during the last 5 to 6 years is there is a broad classification about the working on awareness. One is inside the hospital and one is outside the hospital. So inside the hospital, the work is going on very fine. But outside the hospital, in the grassroots level to the masses, we have to educate the masses in a proper way. Like Mr. Ravindra Mangal nailed it perfectly that in the last moment when the patient is brain dead, rather than counseling the patient's relatives at the last moment, why not go to the masses and educate them about organ donation, about brain dead, so that patients are already ready when such an unfortunate, I should say, incident happens in their life. Now, for this, while working in the last 5 years, we in the Rebirth Foundation, we have come to know that the traditional methods of doing the awareness activities are okay, but apart from that, we have to have innovative ways to reach the masses. Innovative ways in the sense that we have come up with short film competitions. We have done a Rangathon mass activity, then a Bharat Organ Yatra, in which a volunteer of ours goes around the city, whole country and speaks about organ donation to various medias across the country. So we have done these innovative ways of awareness, and we have a lot more ideas which could be effective over the coming years. But for that, we require support. Now the support comes from the government, from the hospitals, and from the corporate world. Now, presently, what we are finding is the communication should be established between the NGOs and the government, so that the NGOs which are working at the grassroots level, the government can implement their schemes immediately with the help of the NGOs. They are actually catching the nerves of the masses. The second thing is hospitals presently are carrying out their own awareness activities. So why not delegate, outsource these activities to the NGOs? And third is about the corporates. Now, when we have approached the corporates, they have huge funds, funds to the scale of crores. Now, when we go there for applying for some funds, they say that your requirement of funds is too small for us. So, for that, we have to do something about that, wherein the maybe the corporates have to be educated again towards what organ donation actually is and how through awareness even they could reach up to the masses. So these are some of the points that I would like to mention, and definitely for awareness work, NGOs have a much larger roles to play than directly an hospital, or maybe the government should have some communication established directly with the NGOs. Thank you.
Thank you so much, Mr. Shetty. I think you brought upon the point very well that NGOs should be used more because they are very closely associated with the grassroots levels of the society. I will now invite Dr. Shashikala Gurpur, Professor Director at Symbiosis Law School, to speak on the subject.
Good afternoon, esteemed panelists, especially our leadership committee, as well as Honorable Judge and other esteemed professional experts. It's my pleasure to join you, and thank you for giving me this opportunity. I was listening to the patients, I was listening to the doctors, the coordinators. It was very clear that there are certain issues which are created because of the uncertainty, legal uncertainty, which pervades the three key areas. One is definition of death, when you're talking about deceased organ transplantation. The second is which is the legal or authorized forum to take the organ donation pledge or to register as organ donor. And thirdly, what we see is other infrastructural issues, especially the superstitions, lack of communication, basically, lack of awareness. So I commend this forum on organizing such an awareness among the stakeholders and bringing authentic voices to the fore. I hope that there is a good YouTube and other coverage to this program. Now, first of all, when we look at the trajectory of how law has facilitated, we had problem with Macaulay's Code itself in Indian Penal Code, where the definition of death is death of a human being, unless there is contrary in the context. So the idea of the context is still there, and how we determine this context in this kind of a medico-legal dimension of a deceased organ donation, deceased person's organ donation is an issue. My own personal experience of understanding blood donation as part of organ donation, or now the plasma donation in the COVID context, and then as the patients pointed out, the kidney donation, the liver donation, what we see is a very deplorable statistics. We have seen that the communication, the concept note itself has pointed out how only 0.35% has been met among the organ donation needs. So we need to be very clear about the procedures. Now, given the limitation of time, I would like to highlight how this section 46 came under a lot of transformation. And it was neglected area for a very long time, because for 50 years the definition of death as cessation of cardiopulmonary indicators was pervading, and the brain death concept came only later. And then we see that in countries like the United States of America and United Kingdom and globally, there is no certain protocol coming about as far as death's definition is concerned. Even the elaboration of the indicators, and there are certain procedures which are established. In India, the organ donation became wrapped in smuggling and other illegal practices until we had the legal regulation, the THOTA, or the human, the Transplantation of Human Organs and Tissues Act, which came into being in 1994. But then, although the legislation regulated, the legislation is not effective. The very legislative dimension itself is defeating the purpose because of the complex procedures, which already the patients have pointed out and the relatives of the patients have pointed out. Thanks to our great doctors, because I always highly revere medical profession for their professionalism, it has been good. But with the commercial dimension of the private health clinics, etc., the money intensive, investment intensive areas, the ambiguity in the procedures and ambiguity in the law further cause pain to the needy patients and the families. So ethically also there is a lot of risk for the doctors when they take these decisions, because doctors are not fully empowered under the legislation. So Kerala was the first state which took clue from the best practices in the world and created a regulation in 2017. Before that, we have had the Aruna Shanbag decision, where the court itself expressed its dismay over the uncertainty in the definition of death, and then interchangeable use of comatose or brain dead patients, etc. And in Aruna Shanbag's own case, the next friend definition was very nicely interpreted by the court and certain procedures were laid out. Later, they became part of the executive order of the government, and that order was issued in 2012. But that executive order was not going to settle the problems. Therefore, looking at the practical issue, since health is a state subject as well, Kerala government in 2017 brought the process. The SOP there validates this process by giving apnea test, by giving EEG and these multi-stage processes, and empowering the doctors as a panel to take decisions in case of deceased donation. However, despite this being easy, the burden of proof is on the neurosurgeon or neurologist in such case if it goes to the court. What we see is there are other risks that are associated, because thereafter you have the relatives' consent to be taken, because relatives are also involved in this standard operating procedure. Now that is where exactly ignorance is stopping the whole process and defeating the purpose, because till then you have to maintain the body in the ICU. The need of the ICU for other emergency cases is also an ethical dilemma that is caused to the hospital. This is exactly where what we need in India is a uniform determination of death act, where we don't leave it to the diversity of practices in the states. I heard that Maharashtra government want to simulate the example of Kerala. So that will definitely strengthen the hands of our doctors. But without proper awareness in the patients and in other stakeholders, the current paucity of donation, which is happening at, I think 4 out of 10 is those who have taken the donation pledge. Madam mentioned about the national organization under the legislation, which is there at the central government level. Secondly, only 4 out of 10 donations are coming out of this, and 2% is from those who are voluntary donors, like the cases we observed. So here we need legal intervention. So the question that I leave with the audience and on the panelists to discuss is the sign-up pledge and the sign-up process. How do we popularize it? Do we use educational institutions and youth forums? Because it is told that even if 5% of the fatal accidents were resulting in deceased donation, that would have addressed most of the organ needs in this country. So do we do that? Second is, well, regulation is a failure because of the other agents such as media and public fora and NGOs being not strengthened and enlightened. So could we do that? Third is, how do we strengthen doctors by a very effective standardized SOP and standardized regulation at the national or individual state level with the guidelines? Thank you very much for giving me this opportunity.
Thank you very much, Dr. Gurpur. Very pertinent points raised. Uniform definition of death is needed. Standardized SOP is very much required. I will now invite Ms. Shilpa Zoglekar, a MedLegal expert, a Bachelor of Law, to please express her views. You may have to unmute yourself.
Thank you very much, Sundar sir. A very good afternoon to all the esteemed panelists. When the session started, Shubham made a statement on hope. He is hoping for an organ transplant. So I would also like to start on the same lines. Hope is the pillar on which rests the world of the organ, people who are want of organs. While preparing for this talk, I came across many stories where hope was the central character. Holding on to hope, many patients await their chance of receiving an organ through donation, which could make their life better or make them live longer. Speaking about the statistics, Spain leads the world in organ donation. 36 donors per million people is what the count is in Spain, followed by US, that is 26 donors. Whereas India, it is just 0.26 donors per million people, which means that there is only just one donor in 40 lakh people. So the reason why India needs more donor is that 4 lakh people die every year waiting and hoping for an organ transplant. There is a wide gap between the number of organs required and the organs which are available for donation. In 2017, there were only about 11,000 transplants, while the requirement was far more than 4.5 lakhs. Coming to the reasons as why there is such a wide gap, it could be attributed to the limited awareness, the social economic reasons, the religious and the cultural differences, and the legalities involved in the organ donation. The Transplantation of Human Organ Act was enacted in 1994 and underwent some changes. And it was amended in 2011, and the rules were amended in 2008 and 2014. I will not go into the details for the purpose of why this act was enacted and other stuff which all of us are aware about. But a simple and a seamless process of implementation of this act will go a long way in getting more and more organ donors. Coming to the 2 points which I would like to highlight in this talk would be the uniform definition of death and how to create more awareness about organ donation. 3 Indian statutes define death differently. The legal definition of death as per the Registration of Births and Deaths Act says that death means the permanent disappearance of all evidence of life at any time after life birth has taken place. Similarly, IPC section 46 defines death as the denotes death of a human being unless contrary appears from the context. And the Transplantation of Human Organs Act has added the brainstem death. So the lack of a single uniform definition of death creates a lot of legal issues, especially in organ donation. In case of a brain death person, the lungs and the other parts of the bodies are functioning as a unit. And it is a very well-known fact that even after agreeing to donate organs and completion of all the formalities, the patient's relatives take back their stance of organ donation. So even if the patient is dead as per medical sciences, legally he is alive. And this is the cause of confusion and a big hurdle in declaring brainstem deaths. So the suggestion I would have would be a uniform definition of death, which would include brainstem death, so that the declaration of death is simplified. Coming to the second point about creating awareness on organ donation, a lot can be done on this front. Many speakers before also have mentioned about creating awareness. Right from the higher grades in school, where the students should be exposed to organ donation, special sessions can be conducted as a part of their life skills where they know about organ donation. Thanks to the current pandemic, the young India has now become very tech savvy. So this is the age group where you could target them through social media on the various myths and facts about organ donation. The third aspect is the media. Media plays a very vital role in creating awareness. Media, both positive and negative, but I would like to emphasize on the positive media coverage. Positive media coverage on organ transplants as against the negative coverage on organ trafficking. And lastly, speaking about choosing to opt out or the presumed consent. Spain has this law where each and every individual has given a consent for organ donation. Only and only if he is not interested, he can opt out from organ donation. England also has passed this law in March 2020. Every adult in England is considered a potential donor unless they choose to opt out. So even if we continue with our current opt-in method for organ donation, consent should be actively sought during the issue of driving license or renewal of driving license, passports, or any other government document. The government should work on capturing this consent with a linkage to their Aadhaar cards. This will ensure the ready availability of information at the right time, especially because accident victims happen to be the source of cadaver donation. I would like to say that with the hope that the definition of death may be amended and by the authorities and an increase in the awareness about organ donation, I would like to end my talk. Thank you very much.
Very, very nicely and aptly put, Shilpa Joglekar ji, and I think very, very important and pertinent points. But this uniform definition of death keeps coming up again and again. And I would now like to invite Mr. Mahendra Kumar Bajpai, a stalwart in the medico-legal scenario, and has been advocating the simplification or education of law for doctors for many, many, many years now. Advocate Supreme Court and Honorary Director of Institute of Medicine and Law, Mr. Mahendra Bajpai ji, please welcome to the mic. You may have to unmute yourself, sir, please.
Thank you, Sundar sir. Dear friends, a very good afternoon. Organ donation is a vital issue in healthcare today. No one disagrees. But there are issues that need to be addressed to make it easier and to increase organ donation. One legal issue very close to my heart, very important and relevant in today's context happens to be Uniform Determination of Death Act. Most of the speakers have spoken on it, on the importance and why it should be legislated in India. I'll speak on other topics, legal of course, which are important. The first one, there are certain statutory requirements that have to be fulfilled by doctors. This must be done away with. All procedural requirements must be handled by either the hospital administrators or the statutory authorities. Why should a doctor buy trouble in these troubled times? This is the most simplest and important change that must be done if we have to promote organ donation. The second suggestion, is regarding cadaver donations from medico-legal cases. Patients who are victims of crime or accident. Law is absolutely clear in India that the police officer has a discretion to seek a post-mortem. But in real life, the police officer seldom uses this discretion, even in medico-legal cases where the patient has been hospitalized for a few days, for a few weeks, and the reason for the injury is medically documented and confirmed. The dead body, even in such cases, is routinely sent for post-mortem. I suggest that specific rules must be laid down for organ donations from medico-legal cases, and the decision on post-mortem must be taken by higher police officials in active consultation with the medical team who was treating that patient. This will make a big difference in organ donation. Speakers have already said that even if a fraction of the medico-legal cases donate their organ, it will make a huge difference. The third suggestion is regarding unclaimed bodies. The law permits donation from such bodies, but the procedure is missing. The detailed procedure is missing. Lawmakers must focus on this aspect also, consult all the stakeholders, and come out with appropriate rules and regulations. Thank you.
Thank you very much, Mr. Bajpai, for keeping it very short and crisp. We've now reached the end of our panel discussion, and in my experience, I must say that Pune has stood out to be one of the quickest and possibly the most value-adding in their own right. And this is our fourth such city after Ahmedabad, Hyderabad, Kochi, and today in Pune. With this, I would like to invite our esteemed chairperson for the day, Justice Ravi Tripathi ji, to tell a few words after listening to what has happened today in Pune. Justice Ravi Tripathi ji is the chairman, Gujarat State Human Rights Commission, and a former judge of the Gujarat High Court. Justice Tripathi ji, over to you.
Namaskar. Good afternoon to everybody. Friends, it was a very fruitful discussion, and I must say that I am enriched in the knowledge on the subject of organ donation. Friends, one thing is certain that the procedure people do find to be clumsy, maybe little confusing, but then the difficulty is that this is one field where there are all the possibilities of mischief being played, and therefore the simplification of procedure cannot be at the cost of taking care of the mischief. That is one part of it. Possibly alternative to that is that NGOs like the Rotary Club, one of the speaker, Amrita Devgaonkar, said that they are taking care of this particular movement. Then possibly one suggestion which occurs to my mind is that there could be a deputation of one volunteer with the donor and donee, and he should try to take care of that particular procedure. Possibly that is a better solution. I don't mean that procedure should not be focused on and it should not be attempted to be made simpler, but till that is done, because that will be a long drawn exercise, and until that exercise completes, possibly this is one possible solution to that clumsy procedure or difficult position. So far as organ donation part is concerned, Dr. Bhagwat Karan did say about that financial assistance from the PM's some scheme. Well, this could be one more facet which could be taken to the PM office, and they could be said that there should be some special provision for organ donation and their incentives. So that could be the second one. And the third one is, I think whenever it comes about the awareness part, on every possible occasion, that could be meeting of the Rotary Club, that could be meeting of the NGOs, that could be a school function, there should be number of videos of successful donees, not donors, donees. They should be played in the public, and they should be made aware that how one simple attempt on the part of a donor of donating the organ has made hell of a change or say the great difference to his life, and possibly that may sensitize people more for the organ donation. So far as awareness program is concerned, I'm again referring to Rotary Club because I'm also one of the Rotarian. That should be on a regular basis. It should not be taken on an annual basis that all right, one particular year the Rotary president was very much aware to this organ donation, so he took some of the programs. But no, it should be made part of the regular curriculum of the Rotary Club itself, and they should have every year some program on that. And especially, I think what is required to be done is more attention is required to be taken to the schools and the colleges and the educational institutions, because at that particular age, one particular impression which is gathered by the student or a person, that lasts longer for the person, and that will definitely help. Friends, there is a lot of things which can be talked about, but then so far as that common question which is coming up every time, and this is my second meeting which I'm attending, about the common definition. Friends, it will again take a long time, but then before that we should take some steps by which we can encourage this movement. And not only that, one single donation becoming successful makes a difference to the life of that particular donee. So in that particular situation, I think everybody deserves heartiest congratulations on this successful event which is being done. And my special thanks to Ravindra Mangalji and also Mr. Sundar Rajan, that this type of attempt should continue as we are doing on continuous basis. It should be also in the schools and the other NGOs and the organizations like Rotary, that they should have this program on regular basis. I think this is really wonderful program, and I think my day is done. So thank you everybody. Namaskar. Namaskar.
Thank you so much. You've been a guiding light, and people like you inspire us to keep doing this work. But we are mere facilitators. I would like to invite Dr. Bhagwat Karatji for a few final words, please. You may have to unmute yourself, Dr. Karat.
As Honorable Justice has said, this is a very important things, and all the panelists has spoken very nicely. This is a very important, as it is discussed, to be more aware in the field. So awareness is important, and this awareness can be achieved by different NGOs and different functions, and that will need repeatedly. So I am sure that different NGOs and different functions can be arranged. And as far as some panelists have said, the Spain and other country, the donation is more as compared to our country. And this will come after education and after awareness in the public only. As far as the financial help is concerned, there is in Maharashtra, there is a Chief Minister Relief Fund is also there. The patients can approach there also. I am here from any part of the India. If they write to me, I will give the mail ID to Mr. Sundar or Ravindra. Then I will be able to sanction their files, and the help is around 3 to 5 weeks. I don't know the expenses, that is different in different hospitals, but we can help this also. But ultimately, this Institute of Law and Medicine is doing a very good work. They are consistently working for this good cause. So I congratulate both of them, and I congratulate all the panel also. They have also explained everything nicely. But such attempt would be, the country is a big country. The peoples are more, and so this attempt should be done frequently in different part of the country. Then and then only the national level, the figures will be good. But I will say this is just the beginning. I am joining this since last 6 months. Sometimes I have joined, sometimes I have not joined. But anyway, as a doctor, and as a politician, I am very much interested in this work, because this will save the life. This will save the lives in thousands, in lakhs also in future. So I congratulate, and I hope we'll meet soon. I don't know the next time, but I will be busy in the parliament for next 1.5 months in the session. But I will be in touch with Mr. Ravi and Mr. Sundar. Thank you very much.
Sir, very nice of you to have penned the final few words of this session. I would now invite Mr. Agasti Matre to give the vote of thanks and to bring a close to this session, please.
Thank you, Sundar sir. Dear esteemed panelists and our viewers, I thank you all for attending today's session. I thank parliamentarian Dr. Bhagwat Karad for extending his support from government side to help the patients like Mr. Shubham Sharma. Dr. Bhagwat Karad, I thank you again for that. I thank Dr. Justice Ravi Tripathi ji for always there for us, for giving us the moral support what we always needed. I thank all the other panelists for being here today. Thank you so much.
Before we close this session, Sundar sir, I think we have forgotten to invite questions. We have a lot of people from the media, and if there are any questions, you are most welcome to put that.
Okay, so any other questions from media can please be routed through the organizing committee to us, and we will get it to the respective panelists. With your permission, Raviji, we'll now bring a close to this session. Thank you so much. Pune has been the best so far, I think.
I agree. Thank you so much, everybody.
Thank you so
Have
much.
a great day.
All right.
Thank you. Thank you so much.
Thanks a lot.
Thank you.
Thank you.